My name is Tom Allan. I'm a doctor at UC Davis of internal medicine. So, just like we have enkephalins and endogenous opioids in our body, we also have endocannabinoids. So let's say you play basketball and roll your ankle, you're going to get pain right away. So at the site of pain, these little chemicals will go to the site and help you reduce the pain and swelling. So where CBD works, it kind of inhibits the breakdown of those natural endocannabinoids that would already be there. So it kind of prolongs the pain relief. They're endamamine and 2-AG, longer names, but I won't go into that. But there's also multiple other types too. So like when you get injured, those are the sites. It will hit the CB1 and CB2 receptor in the cell synapse. And then what CBD does, it kind of prevents those from being broken down fast. So then those effects are more in the synapse, thus you get more pain relief. Another benefit too is, let's say you do use THC, which has an added benefit for pain and sleep. It actually helps blunt the psychotropic effect of that, so that's more attractive. So I'll have patients that have never used marijuana before, they're quite naive, and I wouldn't feel comfortable go ahead and take some marijuana without knowing what's in it, so they're kind of concerned. They've actually told me they've tried it, and they just didn't like it because they made them too paranoid. So then you ask a little bit more detailed question, well, did you know what THC or CBD was in it? They don't know, but if you do more CBD based, you can kind of help blunt that psychotropic effect. Their pain's better controlled. They don't have to rely on opioids, which slow down the respiratory drive. And the good thing about endocannabinoids, they're not going to slow down your respiratory rate because they're not in the brainstem, which is really important. So you can't really overdose on them. Well, what you do, you get to know the product. You get to know what's in it. So like a ratio of like 2:1 THC to CBD, or a 1:1 ratio if you're a novice. So that's what you get to know, other than the person on the street. And I've had the same conversation with my mother-in-law last night. She said, oh, you're promoting this drug that people are going to be stuck underneath the bridge and they're going to die. And no, just relax. Just think of it this way. We're trying to get people healthier. And there's a lot of studies showing that the long-term effects are actually pretty good. They have benefits to the cardiovascular system, they prevent cancer, they actually slow down bone deterioration. So there's a lot of good substances out there and benefits. But my main focus was pain in the beginning, and so I was just trying to get people off their opioids because obviously that's a major problem right now. And so what I would explain to somebody like your mom, say, look, you're right, there are some concern about the THC, but once you understand what's in the product, you can sort of change it around so you get that benefit without getting too much psychotropic. And you start kind of low, like with any medication, like we might put somebody on a depression medicine that maybe they're elderly, you put them on a really low dose and you see how you do. Come back in a week, maybe try a little stronger dose. And they say, okay, this is a good dose, let's stay here. So that's kind of how you probably do it with this product. So THC and CBD are two different endocannabinoids. And basically what they do, they hit different receptors in the body. Okay, so for instance, THC would hit CBD1 and CBD2 receptors, where CBD doesn't really hit those receptors as much, but it hits other receptors which can help with the THC down the stream. So in other words, it kind of blunts the effect of THC. What's really interesting now is the autoimmune diseases like lupus or rheumatoid arthritis, and you see those commercials on TV where it may cause death or may cause infection. Well, interestingly, the effects of CBD and THC, they hit the CB2 receptor, which is kind of interesting, and it'll help reduce these inflammatory markers like mast cells and lymphocytes and natural killer cells, and so many to mention, like these cytokines, which some of them would be really dangerous if you were to take like Enbrel, one of these really strong type of medications that are commonly used for like rheumatoid arthritis, where this would be more of a natural form of it. So it's probably at a pretty safe level in the system. So people might have insomnia, but then realize, my joints don't hurt, they don't swell up as much, that's kind of nice. So there's some added kind of, entourage effect, if you will. It's a drug, and you gotta be taken seriously. Like, you don't want this lying around with your children present. Like, you wouldn't want ibuprofen or opioids lying around with your kids present either, so you gotta respect it. So for those people that are using it for recreation, I use caution on that, because there is some chance that there might be some harm. And what I wanted to learn about, which got me intrigued, was I just assumed most people are using because it's now legal. So I wanted to know what was doing to the drugs I was prescribing. For instance, there's a lot of drug-drug interactions. So I might have to lower the blood pressure medicine, I might have to lower the seizure drug, which is kind of a good thing, because if you're taking less medication, you tend to feel a little bit better. So also drugs that are very serious that can cause bleeding, like warfarin. If you put somebody on warfarin, you got to check their labs very carefully. If you take THC or CBD, it might adversely affect that, so you got to lower that warfarin dose. So it's really important to know from a doctor's standpoint what are potential problems. And what I was finding in my clinic, there's only like 2 out of 14 doctors, I'm one of them, that was open to go ahead and study it a little bit. Well, one thing, you're taking less medications that can cause harm. So, for instance, you go to the drugstore, CVS, and get ibuprofen. Nobody thinks twice about it, but that's a pretty harmful drug. You play basketball all day, your knees are hurt, you're going to pop about 2 or 4 of those a day, right? Think nothing of it. Then you're going to go to your doctor 2 years from now, your blood pressure's high, your kidney markers are up, and you go, what the heck, how did that happen? Well, that's because of ibuprofen. If you ever talk to a kidney specialist, they hate that drug. It just does everything wrong. And then we don't have to go very far with opioids, and we know why that's not such a good idea. We were told like 10 years ago that, don't worry, there's no ceiling, just keep upping the dose. Well, now we have overdose problems, and now we're trying to get them off. And you got to have somewhere to land. And I think CBD and THC is a great market. They can use a natural product, and it'll help their internal cannabinoid system with the endocannabinoids, adenamide and 2-AG, and that's kind of how it is. Well, I would say no on the natural product, but if you took the synthetic, yeah, there's some potential problems with that, because when a drug company sees a potential product, they're going to try to synthesize the pure chemical, like Marinol as an example, much stronger than the cannabis that you might sell in a plant, but it's a Schedule III drug, interestingly, whereas marijuana, like a product is a Schedule I drug, so which they need to get that reversed, obviously. But so yeah, there are some potentials with that, and but a natural product is much safer. So look at it this way. You think of it, you have these natural endocannabinoids in your body, and they go from one cell to the next, basically trying to tell a story, communicating. If you have pain, these chemicals will help modulate pain and reduce the sensation of pain. And those are your natural chemicals. And how CBD works, it prevents those from being broken down. So they stay in the receptor a little bit longer, and that's synapse. So you have more pain relief without the psychotropic effect of THC. So that's the benefit of CBD. You can rub it on your hands. If you have joint pain, you could take it by mouth, obviously. You can vape it. So there's a lot of different ways of using the product. Well, I'm in the process of tapering all my patients off opioids. And it's a hard thing to do, like 1 or 2 pills a month, down from 140. So it's a very slow wean. But now I have something to have them land on. Say, hey, look, I'm not going to be that type of doctor that's just going to wean you off and you have nothing to do other than meditation and yoga. Now you have a product that actually works. And now I've got answers why it works, because it has a natural endocannabinoid system, and CBD helps increase that, so you have more of a better effect.